Thank you everyone for coming along this afternoon for what is an incredibly exciting event. Over the last 2 years we've been doing similar events to this for the public, but it's about time that the health and social care system of Somerset had its own event. So we've got a sort of an eclectic mix of things related to metabolic health, and I'm particularly really excited to be here this afternoon because it's something I've been extremely passionate about for the last 4 to 5 years, and most of my day now revolves around getting up in the morning and focusing on something related to what we're talking about today. The reason I'm so interested in it is there is an enormous need out there for people to have support and the knowledge to improve their health. When you open your eyes and see what's going on with the healthcare systems around the world, they're absolutely collapsing. And our typical model of dealing with that, which is diagnose a inverted commas disease and then put people through a drug production line, is not helpful for everyone. What is helpful is probably collecting together the people in this room, the people speaking, the population across Somerset, and actually starting to really address the root causes of what's happening and turn around the epidemic we're seeing. And the nice thing is, and if some of you may not have been exposed to all the information you'll see through this afternoon, the nice thing is suddenly there is an enormous amount of hope you can have. The sense that actually the difference we can make is far outstrips anything else I know, certainly in medicine, and where if you wish to get involved with this sort of thing, when you use a unit of energy, the outcomes you will see for that are just incredible. So just very briefly, to put it all in a bit of context, and just, I guess, my background as a GP, I'm Health and Wellbeing Lead for the CCG. I'm also Chief Medical Officer for diabetes.co.uk. Somerset, 7 to 8% of the adult population got type 2 diabetes. 2/3 of the adult population in the UK are overweight or obese. 1/3 of the UK population have got pre-diabetes. That in itself is costing Somerset at least £150 million a year, if not more. Poor metabolic health is driven mainly by lifestyle factors, including what we eat, our physical activity levels, sleep levels, amounts of chronic stress, and obviously there's a genetic component. And there are an enormous number of things related to it. So if you just reflect on these as they're read out and think about the people you see in your day-to-day work, what percentage of people does this make up? So we've got type 2 diabetes, pre-diabetes, obesity, heart disease, stroke, non-alcoholic fatty liver disease, gout, some cancers, dementia, some inflammatory processes, polycystic ovarian syndrome, thrombosis, kidney disease, depression and anxiety. Certainly as a GP, this is what creates the need as we walk through the door, and our model for meeting this, our traditional 10-minute appointment model with a drug at the end is providing people, I think, with a disservice, but it's so easy to do something better.